Imagine this is an artery. It's perfect and pristine and nothing is there. And this is what people think about when they think about arteries that are good, like in kids, like my 13-year-old son. What happens when you get atherosclerosis or hardening of the arteries? That's a progressive laying down of plaque, but it doesn't happen in here. It happens out here. So when you look at an artery that has atherosclerosis, it looks less like this and more like this. Still looks perfectly fine on the inside. It builds up on the outside until such time as it starts creeping in slowly into the diameter of the artery and you don't have the good flow. What happens in a heart attack? Some of this ruptures into it, starts closing it off, your body forms a little clot in there and you get no blood flow through it. And if it happens in your heart, downstream muscle of your heart doesn't get the blood flow. It starts screaming in pain, some of the worst pain you'll have, crushing chest pain, arm pain, all of those symptoms. And if you don't get flow back restored in time, that heart muscle will die. And if too much dies, your heart can't function and you will die. Did you know that 25% of the people in the United States who discover they have heart disease discover it with sudden death? Not a great way to find out. So, what can you do to prevent heart disease? Well, to prevent atherosclerosis, you need to control your blood cholesterol, specifically low-density lipoprotein, and even more specifically, ApoB. You can get those levels from your doctor. They can check them out. To reduce that, there are a number of drugs, statins, and other drugs that you can use to reduce that laying down of plaque and keep your arteries young and healthy for as long as you can. Because you don't want this. You want this. Unless you're sitting at the toilet, in which case you want a full roll. But that's another story.